What do you think? What does digital transformation mean to your organizations? An opportunity or a threat? Digital transformation means business process automation, or the processes must be also redesigned. As a citizen, as a professional, are we ready to face this transformation? Do we meet the required skills? Hi, my name is Yolanda Lupiáñez, the head of digital transformation at Fundació TIC Salut. Hosting this session from TIC Salut, we would like to give you some insights about these questions. To achieve that goal, we intend to share with you our own vision and experiences, but combined with those of relevant professional healthcare from several hospitals, and also with the public authorities, which I would like to thank you especially because of your interest, your time, and your willingness to share with us this session. So welcome everybody, both those who are here at the room with us, and as well as those following through internet. For those joining us virtually, just a reminder, you can send your questions by clicking on the Q&A on the right side of the screen or on the app. Today's session agenda is divided in 3 parts, 1 presentation and 2 roundtables. Let's start with the first presentation. Vision and experiences from TIC Salut Social, hosted by Josuè, the director of the TIC Salut Social Foundation. Please, Josuè, the floor is yours.
Okay, thank you very much to attend this session, dear friends and colleagues. The idea is to explain you the strategy and the projects that we are carrying on by our foundation, but obviously by the government, by the health department, and all the health providers ecosystem. First of all, let me introduce our foundation. We are a body of the government. Our focus, our goal is to facilitate the digital transformation of the health and care systems. This is not just to develop new systems, new technological systems, but the idea is how to transform the health provisioning. Our expertise or the projects that we develop can be structured in six main areas. Dissemination activities, or how we transmit the technological point of view, all the things that are happening here and outside Catalonia, in Spain or in Europe, are related to digital transformation. Project coordination, it's clear. Technological innovation and proof of concept. The idea is that technology can help us, so it's necessary to explore new technologies, how can be used to solve the challenges that the systems ask us. The second one is to define models about how to give these services to the citizens and to the professionals. Those models are not only theoretical ones, but we develop several solutions that then can be spread to all the system. Interoperability and standards, it's mandatory that all the systems that we develop should be done under interoperability and the use of standards. Obviously, it's necessary to interconnect all the systems. And the last one is the DGPR. We are the data protection officers of the health system. So it's not only a service that we develop for citizens of our health providers, but it's a way to think about how to design the solutions. So for us, this is very, very important. Well, okay. We are not alone in this way. We have a lot of interaction with the in ecosystems. We belong to international networks, and obviously we develop international competitive projects funded by the European Union. And we have a lot of partners. More of them are here. Thank you very much to collaborate with us. This is a way to work, collaborating every time, everywhere. But one of the things to define in the strategy is to have clear the challenges of the system. Here we have pointed 5 of these challenges. First of one, an aging population, the disease chronification of many diseases, the lack of healthcare professionals, I think it's very clear, an unequal distribution of resources, professional, hospital, and the services that we offer to the citizens. And the last one are the new forms of relationships between citizens or between citizens and practitioners. So it's necessary to answer these challenges to offer the best services to our citizens. But the question is that there are a lot of different answers to these challenges. It makes that it's necessary to have guiding principles. The idea is, well, if we are going to solve these problems, how are we going to do this? And here we have 5 of these guiding principles. The first one, equity. The health system must be equity for all the systems, for all the citizens. The services that are offered should be equal, depending or not depending on the sex, the aging, or the place where you live. The second one is the quality. The objective and subjective quality of the services that we offer. The third one is the security. Remember last news about security in the devices, in the technological system of the hospitals, and so on. Privacy. Each day more and more, the use of data is a huge, is strong in the health system. So how you use this data is a very question, a very important question. So it's necessary to do this with privacy. And the last is the sustainability of the system. Not only economical sustainability, but ecological. How we offer this. Okay, so we have these principles. We have the challenges. We have the principles. So we developed different projects, and I'm going to explain you 6 different projects that we are doing now. The first one is how to implement artificial intelligence in the health provider. The question is not how to develop solutions. The question is how to implement these solutions in the health providers. So we have launched this project, or this program, with 3 different main areas: research and innovation, how we innovate in solutions. The second one is the evaluation of the solutions. Those solutions must be evaluated, not only the first day, but in a continuous mode. And the third one is the implementation, the real implementation of this one. In each area, we have defined different strategic actions, launching of challenges, supporting local initiative, an observatory, evaluation of solutions, monitoring the implemented ones, the integration of tools, the training, or the communication. Now we have started this artificial intelligence project, and next month or next weeks you can see the results of this project. The second one is the proof of the pilots and tests. Here we have an example of a 5G lab. Now we are installing a 5G lab in Terres de l'Ebre with the Digital Policies Department and the local authorities. The idea is we have challenges from the practitioners of the zone. So can 5G help us to solve these challenges? The challenges must be defined by the users, but we know how the technology can help. Well, we're starting, okay? And we hope that 5G obviously can help and can introduce new solutions. In the aspect of digital transformation, here you have the main goals, but let me introduce two different projects, Latitude and mConnecta. The idea of Latitude is to define and to implement a reference model for digital and remote healthcare services. And this digital transformation have to show 5 different objectives: improve people's access to healthcare services, ensure the right to access in non-essential healthcare services, promoting people's empowerment, promoting people's autonomy, and improving professionals' problem-solving skills and tools. So we have defined this reference model, but we are helping the hospitals to implement these models. We have defined these sheets helping the practitioners how to use the different non-presential services, phone, e-consulta, or telemedicine. So we are developing and we are helping to implement this. The other one is mConnecta. The idea is that there are a lot of mobile devices, apps, phones, medical devices that must be connected to the systems of the hospitals or the hospitals or the healthcare providers. So the question is, if I have different mobility providers and different systems, it's very difficult to interconnect. So we have defined a module, a software system called mConnecta that is a gateway that connects the devices with the systems. This produces a data lake of data that can be used to offer health solutions, but also for innovation and for research, obviously complying with the GDPR, obviously. This is mConnecta is a model developed that is in test field, and we hope that next month can be really used in all the system. This is a solution for all the system, not only for one hospital, but for all the health providers, public health providers that that can use this solution. Another project that, well, it's that next round table should be explained in more detail, is about digital skills for care professionals. In a previous session, people ask about the skills of the professionals to use all these tools that we're designing. Not we, not only the foundation, but the system, the providers, the technological providers. It's if the practitioners, the nurses, or the citizens have not the necessary skills, how we are going to use these solutions? So I don't do a spoiler. Maybe next, just in few minutes, you have the answer. And the last one is the data protection officer. As I mentioned, we are the data protection officer of the health system, health providers, and also research and innovation centers. So we offer these services to all the system. But the question is not only the compliance of the GDPR, the compliance of the law. The question is, how can we help to all the ecosystems to use or to transmit the benefits of the GDPR to the citizens and to all the ecosystems? Remember, the personal data records belongs to the citizens, not to the practitioners, not to the nurses, not to the government. So it's necessary to prevent a not good use of this data. Well, I think that, thank you for your attention. Thank you very much. I'm sure that next tables can deep in this kind of solutions and challenges. Thank you very much.
Let's move on the first round table, presenting 3 different experiences of digital transformation applied on different processes: diabetes, heart failure, and medical image. This table is moderated by my colleague Jesus Berdun, responsible of the model for digital remote healthcare services at the Fundació. Jesus, the floor is yours.
Remove my mask. Thank you, Yolanda. Thanks, Josuè, for this interesting starting of the session. I think you've created quite a lot of expectations for the 2 coming roundtables. So let's start with the second part of the of the session. A digital revolution is transforming the world as we know it at an unprecedented speed. Digital technologies have already changed the way people interact and organizations operate. In this context, we need adequate policy frameworks, appropriate skills, and infrastructures and tools to capture the enormous value created by the digital economy and to make a success of digital transformation. I was quoting a briefing from the European Parliament from 2019 on this topic, but what is digital transformation? What do we understand by digitally transform in our organizations and in our processes? I'm sure there might be as many answers as people in this room and most probably in this Congress, but the most simple one is to change the way we do things and to do it using digital tools. I'm sure this may sound very simple, but the consequences and the implications for healthcare can be enormous. Let me give you some examples on this. Catalonia has one of the first digital imaging cloud in a public healthcare system. Can you imagine how much information is stored on that server? Any guessing? Let me tell you that this system is currently storing more than 2 petabytes of information. I think that's equivalent of 13 years of high-definition television, or if you prefer, like more than 20 billion photographs. Digital imaging has become an endless source of knowledge. And we'll see later on a little bit more about this topic. AI algorithms can actually help us to deep dive into this knowledge and to generate value for health. This has been one of the examples that we'll see later on in the way that is helping us to change the way we do things, as I said earlier on. But to generate value, we must remember that there is a need for policymakers, healthcare professionals, companies, research innovations, and other many stakeholders to work together and to identify opportunities to enable this change. And most of all, this change has to address the needs of the society and has to be sustainable. If you have attended one of the sessions early this morning, culture and organizations were two of the main barriers of adoption in this aspect. So we'll try to give you some examples on this in our presentations. Let me also give you another two facts on how digital transformation is helping to address two of the highly prevalent diseases in the world, which is diabetes and heart failure. There are studies that suggest that self-management of type 1 diabetes means to control up to 600 different items every day. Actually, the study suggests that it may be as complex as running an airplane. I don't know about it, but fortunately, patients have slightly changed their pencil and notebook to more powerful tools, as we will see later on. For the case of heart failure, which is one of the major causes of hospitalization, contributing to almost 2 million admissions a year in Europe, digital tools are currently helping us to provide more integrated care services, better sharing of resources, and allowing different care levels to coordinate their work and to optimize the use of healthcare resources. So I think I've talked enough. Let's hear from the experts who will throw some light on which has been their journey towards digital transformation, which have been the drivers and barriers of adoption, and which have been the actions towards the uptake of solutions of successful stories in a healthcare ecosystem. So let's start with Dr. Juana Flores. She's currently serving as Associate Medical Director and Head of Endocrinology and Nutrition Department in Hospital del Mar in Barcelona, and she'll be talking about how to optimize diabetes care through digital medicine, incorporating this experience, this perspective of patient and healthcare professional experience. So please, Dr. Juana Flores, the floor is yours.
Thank you, Jesus. I want to thank the organization for inviting me here today to have the opportunity to give you a few hints of how did we decide to restructure the process of diabetes care at our diabetes unit in our hospital. In diabetes, the last years, there's been a huge amount of new technologies that have completely changed the horizon of diabetes care for patients. There are many opportunities that we need to integrate in our process of care. And digital transformation is just a huge opportunity to be able to improve not only the efficiency, but most importantly, the patient experience, and also the experience of professional healthcare givers and the quality of diabetes care. So with this in mind, we designed a project that was called David Mar. We started 2 months before COVID started. So we had in mind to improve patient and healthcare professionals' experience, combining both telemedicine and on-site visits. We wanted to optimize also health outcomes, the efficiency and quality of care with the uptake of all these new diabetes technologies, and we wanted to reduce on-site visits through telemedicine solutions. How did we design this project? First, we had to identify the different diabetes patient archetypes. There are different types of patients that need certain types of solutions that they may not all be the same. So it is very important to keep in mind what are the different archetypes of patients that we have to think about for this change in the process of care. We identified 6 different types of diabetes patient archetypes. And then we did interviews with these patients. We had interviews not only with patients, but also with healthcare professionals to design the journey map, the patient journey map, and also the healthcare professional journey map. Because it is very important to know not only what information, if you're giving the right information at the right moment, to the right patient and using the most effective communication channel. So you have to keep all that in mind to decide how you're going to restructure your process of care. And after these, we had to classify the different types of interaction that patients and healthcare professionals may have. We have phone calls, video calls, we can have emails, we can have chats, we can have platforms that can help us to get all the data from the different diabetes technology products. And we had to analyze and classify all those possible types of interaction to decide which one would be better for each process and for each particular patient. And also, we had to classify all the possible and the available telediabetology solutions, which are a very long list that sometimes causes a certain distress, mostly in healthcare professionals, both doctors and nurses, because there's such a big amount of new technologies that you get lost in the middle of a lot of information. So you have to select what type of technology really gives you an advantage for a certain objective that you may have for a certain patient, and try to reduce this number of, this very big number of options to the ones that can give you more value at your institution for your goals. And then with all this information, we did a process re-engineering to try to be more effective and always with a patient-centered approach. And so the model was, before we started this project, that most of the contacts with our patients were on-site, and we had a different protocolized number of visits at the diagnosis and when the treatment started for diabetic patients. And then patients went to an advanced treatment phase where mostly group sessions were given to implement insulin pumps or continuous glucose monitoring systems, and then the follow-up was consisted on-site visits with both the doctor and the nurses. How do we want it to be? We think with the new technologies, we can change this model, and we can reduce the number of on-site visits. It is obvious for patients with diabetes that have a chronic disease that you're going to have a contact with your doctor for many years, that you do have to create some kind of attachment with your patients, and we believe you still need to see your patient every now and then. So one of the things we've realized with the COVID pandemic is that we cannot switch completely to 100% face-to-face visits, because at some point you have to create this relationship with your patients. So in this new model, we propose to reduce the number of on-site visits to half of it, and then give these different telematic tools, such as virtual appointments that could be either by phone call or by video call, depending on the patient and on the availability or on the possible mobiles, that if they can have a real connection with a video call, a proper video call. And we transform the sessions, the group sessions, into virtual group sessions, and that was one of the patients required. They wanted to share their experience with other patients. So I think that's also something very important, that in these group sessions, they are able to share their experience with other patients. And when you're trying in diabetes to give education and empower the patient to take decisions on his own, it helps them a lot that you can put them into contact with other patients that some of them may give them some ideas that are interesting for them. And sometimes what you're trying to explain to these patients, it is better accepted when all the patients can also tell them what their experience was with that, with what you are proposing to them. So the group sessions were switched to virtual sessions. Then we established a channel where patients can request a virtual consultation with us through different ways, either using the email or specific chats in these platforms that are, we have different platforms coming from glucometers, from continuous glucose monitoring systems, or from insulin pumps devices that can help us establish a chat connection with them. We still have the possibility of having a hotline where they can, when they have an urgent matter, they can contact us when they need it. And also one of the important conclusions we got from these interviews to the patients is that they wanted to have more information. And in the area of internet, where there's a lot of information, if you just type diabetes and anything related in the web, you can get thousands and thousands of pages. Patients want to be guided. What information is important to me? I want you as a professional to tell me what is important for me to know, because there's too much information. So one of their demands was that they could have easy access to all the information that could be particularly of interest for them. So we created a web page where we had diabetes patient education materials and also psychoeducational interventions that could be of use to these patients. So just to have a quick overall view of this project, in general, I can say that patients have a very positive perception of telemedicine, but they do demand to keep a contact with on-site visits. So one thing should not just completely take rid of the other. And we also detected in the interviews that there's a need to improve digital skills, but not only in patients, also in healthcare professional, and that is a key component into trying to get the healthcare professionals also involved in this project, because sometimes they don't feel comfortable with the new technologies, and it is important to improve their digital skills. As I told you, patients requested more information. They want you to give them the right information that they may need, particularly in the case of diabetes in dietary advice, and the need to share their experience with other patients, as I told you. With the process re-engineering of the diabetes care process, we identified different performance indicators that could potentially be improved. And with this approach, 50% of our on-site outpatient visits can be replaced by telemedicine visits. And this is particularly important in pathologies such as gestational diabetes. We have young women that are normally working, that they have different schedules with the gynecologist, with the ultrasounds, and for them to have the possibility of not having to come to the hospital for the additional visits related to diabetes was really, they value it especially compared with other situations. And also this is the case for type 1 diabetic patients, mostly the young adults that see in the telemedicine a way of diminishing the burden of having to assist to the hospital and having to interrupt their routine and at work or of the kind. And obviously, when we started this project, and we had to stop 2 months after because COVID came, COVID made us just jump abruptly from this on-site outpatient clinic straight to the telematic, 100% telematic assistance, which now we have to progressively go back into an organized model because I think one of the difficulties is to find equilibrium between telemedicine and face-to-face contact with the health professionals. And that's what we're trying to implement. It's hopefully next April will be 1 year since we implemented our program, and hopefully in the next Congress I will be able to give you some data on the results on patients' outcomes of this new project. And with this, I want to finish, and thank you for your attention.
Well, it's been a really inspiring speech. Thank you, Dr. Juana Flores. I think I take like 2 reflections and 2 practical tools. Know your patients, make it simple in terms of which are the available tools there for your professionals, And then these super powerful tools like the journey mapping and the assist to be are really super cool tools to be used in your organizations. I really encourage you to start using these very practical tools to establish a dialogue within your organizations and with the patients. You will learn a lot. We've had the opportunity to be engaged in such procedures in mental health and in other conditions, and I think it's really important that we sit down and that we use these very practical tools to start knowing better our patients and professionals. Okay, so let's give the floor now to Dr. Sergi Jun. He's internal medicine specialist at the Community Heart Failure Program, the Department of Cardiology and Internal Medicine in Bellvitge University Hospital, and he will talk us about the Rms program, on how integrated care program is being implemented in Barcelona, addressing the need of patients with heart failure. Please, Dr. Sergi Jun.
Thank you very much, Jesus, for your presentation, and thank you very much too to the organization of the Congress, to TIC Salut, to allowing us to talk about e-health integration solutions in healthcare problems and to talk about heart failure. This is my conflict of interest, and if we have to, or we want to talk about heart failure, because heart failure is a worldwide global healthcare problem due to its high prevalence and incidence that decreases with age, and its mortality and morbidity. Moreover, heart failure is a healthcare. It's associated with elevated healthcare costs to a large extent for a reactive model that increments a lot of hospitalizations. So we have to change our reactive models because we cannot afford this inertia. We have to change our reactive model. We have to improve our models with more proactively models of care that let us reactivity behind. And in this sense, several efforts have focused on improving the management of heart failure and the follow-up during the early post-discharge period. We know the early post-discharge period, the so-called vulnerable phase, it's the period that begins the moment of an hospital discharge and extends from 3 to 6 months after hospital discharge. And it's a critical period, because it's where an important number of new events are compressed. So strategies that focused in this period will be elemental, and for example, e-health solutions in this period will be crucial to implement in our healthcare programs in heart failure. But if we want to implement an e-health solution in heart failure, we ask first we have to ask if e-health will close the care gap in our chronic patients as heart failure patients. And in our experience, we think that our e-health solutions have to integrate strategies of telemonitorization and teleintervention. These are the key elements, of the crucial elements to integrate in e-health solutions in heart failure. But what's the evidence? What's the evidence of heart failure? What's the evidence of e-health solutions in heart failure? The evidence is huge in the last 50 years, but the heterogeneity of the trials, the published trials, due to the telemedicine models assessed, the different heart failure population, the different care settings evaluated, all these are motivated that the guidelines don't make robust recommendations, but nevertheless, in the latest ESC clinical practice guidelines of heart failure recently published, they provide for the first time a recommendation, but it's a soft recommendation of the use of telemonitoring in heart failure. But it's a small step for man and one giant leap for mankind. But as we commented previously, we have evidence of 50 years in the e-health, in the telemedicine and telemonitorization in heart failure, in both in reduction of mortality and heart failure related hospitalizations. But we have to improve our experience. We have to get more evidence to let the opportunity to the guidelines to make most robust recommendations in the future guidelines. In this sense, we designed the Rms Trial. The Rms Trial is a clinical trial, 6-month nationwide here in Spain, multi-center, randomized, controlled open label, blinded endpoint adjudication trial, designed to assess the effectiveness of a strategy of e-health based follow-up in heart failure patients in vulnerable phase heart failure patients. So patients after a recent hospitalization of heart failure decompensation will be randomized to usual care based on face-to-face encounters or telemedicine group delivered by obviously with e-health based solutions. We are 10 participating centers in all the country, and we have to include all the strata heart failure patients. Where are the patients? No, the patients in telemedicine group are delivered. The patients in telemedicine group are delivered by Pyrenees platform. Pyrenees platform is a solution, a comprehensive solution designed for the delivering the treatment, the management of the chronic of the patients with chronic conditions, and selected and designed and modeled for chronic heart failure patients. More detail, patients daily send us the biometric data, say as symptom report with mHealth solutions, and we manage this data, and we can contact daily and remotely with patients if it's necessary, or if the clinical visits are in agenda, and by video conference, by tele-intervention. As I said previously, patients send us daily the weight control, and where, for example, gained a significant weight gain, we can adjust the diuretic treatment because it suggests new decompensation. Patient to daily send us their heart rate and blood pressure, and we can manage this data to adjust the treatment daily or when there's a warning alarm. And patients daily to send us a symptom report about symptoms related with this condition, that's heart failure, and the contacts, the planified contacts, and the urgent, the non-planified contacts if it's necessary due to a warning alarm in the Pyrenees platform. All the contacts are by video conference. So It's briefly, or not briefly, but it's a graphical abstract of what we think about the integration of e-health solutions in heart failure programs, because we can't understand a health solution without a program, a healthcare management program. We can't understand separately. We have to understand or integrate e-health solutions in healthcare programs, as for example a heart failure program, to understand or to be optimal this effectiveness. And as we commented previously, we have to integrate strategies of telemonitorization and teleintervention. And the take-home message, finally, the use of e-health is feasible for real-world heart failure patients. Non-invasive e-health solutions can and should be key to current and future heart failure monitoring. A successful e-health solution is optimal if it can be fitted into an integrated, structured, coordinated, well-defined and well-directed healthcare process for vulnerable phase heart failure patients. And finally, the Rms Trial will contribute to assess the impact of e-health in our setting through hard endpoints and in different healthcare contexts to explore their scalability. Thank you very much.
So thank you, Dr. Yun. I like the sentence, we cannot afford inertia. I think it's a very powerful message also to deliver. We need to define strategies that combine all the available tools that we have on hand. There is no simple solution. We have already seen a complex diagram. Reality is complex. We need to address all these complexities, most of all when we are talking about a highly complex disease like heart failure. So let's finally give the floor to Dr. Salvador Pedraza. He's the chairman of Radiology and Nuclear Medicine Department of Girona Hospitals, professor of Radiology of the University of Girona, and the president of the Catalan Society of Radiology. He believes that medical imaging is the key to improve healthcare and that AI can improve the full medical imaging workflow. So please, Dr. Pedraza, the floor is yours.
Good morning, everybody, dear colleagues. So it's my pleasure to be here to share our experience about artificial intelligence. I don't know how to pass the... Okay. So first, I appreciate very much the invitation to share our experience with respect to artificial intelligence in medical imaging. I am the president of the Catalan Society of Radiology, and I would like to say that radiology was pioneer to apply digital transformation near 20 years ago. So now we are also pioneer and beginners in the application of artificial intelligence. So I would like to share with you 5 ideas. Radiology is important. Radiology have challenges to apply to the medicine every day. Artificial intelligence could be the solution to this challenge, but also the application of artificial intelligence have challenges. So at the end, I will share with you like 6 recommendations, like a strategic plan to apply and to succeed in the application of AI, artificial intelligence, in radiology. So radiology is important, and really most of the medical decisions are based in imaging, and it's coming more and more and more near everything, because it's, and you know that CT and magnetic resonance is considered the most important advance in medicine in the last 100 years. That's why, because imaging is in the center of everything we do. You see assessment of polytrauma, this is an aneurysm, this is a stroke infarction, and this is a tumor. So because sometimes every day by day, imaging has replaced the traditional clinical tools of inspection. And imaging is in the center of the actual medicine worldwide in all the countries. So we use imaging to do the early diagnosis, to do, for instance, in breast cancer, to do diagnosis in acute phase, for instance, in a stroke, to do assessment of the response to treatment, for instance, after tumors, to do the assessment of the prognosis, for instance, after head trauma or trauma of the spinal cord. But also we can do biopsy. This is interventional radiology, diagnostic interventional radiology, for instance, a biopsy in the prostate, and also treatment, for instance, in brain aneurysm. So in all the phases, and in our hospital, in all the countries, radiologists are become consultant for everybody, all the hospital. We at the center, we are friends of everybody. Everybody know us. So we know everybody in the primary care, in the hospitals, and also interventional radiology is increasing because the cost effectivity is higher, so it's much more better for the patient and for the system, interventional radiology, the conventional treatment. And this is also important. Imaging will be much important even than now, because imaging are data, are not beautiful picture, are data. For instance, everybody knows that when we talk about prostate tumor, PCI is important to guide, but now it's gone, because it's much better to assess. This is a magnetic resonance of the prostate. This is a ADC, is a map that we have in the study the prostate, and if we measure the value of this area, that to decide if we go to surgery or to do biopsy, is much more important this than with respect to PCA. So imaging is more cheaper and is the good way to manage any disease. So and this is coming more and more application. We can have radiomics and variables in the hair, in the abdomen, in the brain, and that can help us to do much better our healthcare in every country. So, but we face with problems. This is a problem in all the hospital and all the countries worldwide. We have a lack of professional, obsolescence of equipment, the waiting list, lack of adequacy of the demands, lack of standardization of the protocols, indication. Magnetic resonance is very slow to perform. If you are gone any time in your life, you or your relative to do a magnetic resonance, sometimes need near 1 hour, so some patients cannot afford to do this. This is also a problem. It's difficult to perform advanced post-processing, to do a structural report, also to manage and to measure the radiation dose, also to do interconsultation with other specialists and coordination between community hospital and the reference hospital, primary care, and also communication with the patient. So we have a lot of difficulties in all the countries about radiology. But the good news is that artificial intelligence could be the solution. Artificial intelligence, the experience that we have from the last year, show us that we can apply in all the workflow and can improve the efficiency, effectiveness, and the quality of the medical process. I will show you some examples. The radiologists with artificial intelligence will replacing now radiologists without artificial intelligence. So that's why. Why? Because we can do, these radiologists with artificial intelligence can do a structural report, can do more complex reports, can have can dedicate less time to do request control, perform control of examination or post-processing, and dedicate more time to activities with more value, can be much more time as a consultant, can lead clinical rounds, and can do much better interventional procedures. I show you some examples that come from artificial intelligence. For instance, there are now experiences that we can short the time to perform magnetic resonance to 10 minutes, not 1 hour, half an hour, 10 minutes. That's very important to any patient. Also, we can obtain much better quality examination, for instance, in that case, magnetic resonance in astrocytoma. But also, we can make the decision to do treatment or not to do treatment. In all the hospitals in Catalonia, when we perform thrombectomy, we use artificial intelligence software to decide if we do the treatment or we don't do the treatment. That's very important. In the daily life, we use artificial intelligence, and health has to do much better our job. So AI can be very important in all the process. Can be useful to check if these requests are suitable, to reduce the acquisition time, to do much better post-process with attention that data that can help to do much better management of the patients, to do support to interpretation, like a second radiologist, and to make decision support. So, but everything is not perfect, because if we want to do application of artificial intelligence in our hospital, we face with a challenge. For instance, it's not everybody have the same experience. We have problems to validate artificial intelligence algorithms. Sometimes it's tricky to pass the approval or take the approval from the ethical committees. Also, we need to, as Dr. Josuè explained very well, to follow the data protection law. So that sometimes is not very easy. We also have difficulty with the incorporation of algorithms in our health center, and also we have difficulty to buy the different algorithms. So we face with problems. So now I would like to share to you my ideal strategic plan with like 6 recommendations. What are these 6 recommendations? The first is that I think that we need to think in the patient, and we need, all the patients deserve the benefit of the care should be done with artificial intelligence tools that we have. So we need to do a strategic territorial alliance. It's not only one hospital that have the tools. All the hospital. In Catalonia, we have the Sindicat from the TIC Salut. Maybe could be a tool where we can apply this solution. So alliance between different centers in a territory. The second is that to do multi-center study. It's not saying that to do a validation in one center, later in another center. We need to do validation, multi-center studies. Also, Sindicat could be the solution to do that. The third, we need to do imaging biobank. We know that we have a lab biobank, but also we need imaging biobank with permission from the patients to try and to test if an algorithm is good or not. For instance, if we have X-ray of a patient with COVID, now we have more than 30 algorithms. That the ideal is to have the biobank and to pass all the algorithms through this biobank to check what is the best and what is the worst. It's not saying that anybody went along without to know all the algorithms. The fourth is that we need to apply the algorithms to all the process, not all interpretation. Sometimes the people say, it's to do report. No. It's to see if the requests are correct, to short the time of the examination, to also to talk later with the patient. So all the clinical workflow should be benefit from the artificial intelligence. Also, we need platform. In our daily life, in our homes, we have HBO or Netflix with a lot of different tools. We need the same in medicine. A lot of there is a lot of, for instance, in breast assessment of mammography, we have near 20 algorithms to assess the mammography. So we need all this platform with all the tools to do as better as possible our job. And finally, to recommendation, we need to learn from the pharma. The pharma have a way to do the validation of pharma and to do multi-center study. So now we know how to do. Why we cannot learn from them? And later, there are countries that are doing very well. Israel, Estonia, Lithuania. Why cannot learn from them? Because they are institutions that make easy the application of artificial intelligence in their countries. So my message is that we need to develop a strategic plan to implement artificial intelligence in the radiological workflow in our hospital. Thank you so much.
So, thank you, Dr. Pedraza. So we've seen how artificial intelligence can be a very powerful tool, much more when it's actually surprising, no? Like I like this statistic about 85% of medical decisions are related to radiology. So I think there is a long way ahead on this. So I will ask now all the panelists to go to the table. We'll have a very short time, I'm afraid, for questions. We have one question coming online, since there is also people online connected. These hybrid models sometimes is difficult to manage. So I also encourage the audience who is virtually connected to send their questions. So I will start with one question from the virtual chat. Then I will ask 1-2 questions. I think we can still allocate time for those 2 questions, and then we can move with the next table. So there's this question from Ming Wilfred Lee. How is the response from the elderly diabetic patients? Did they have any difficulty in using digital communication device? I think this is addressed to Dr. Juana Flores.
Yes. Well, actually, the elderly patients are a case where you have to adapt to their situation. And what you do with elderly patients, or those patients that are not capable of using these new diabetes technologies, is you have to focus on the caregiver. Because normally, these patients, they have a caregiver that can be somebody of the family or some social assistant. And for example, what we do is these glucometers that can transmit the information to the mobile, and then that goes to a platform that we can actually check the results from the hospital. So we connect the glucometers to the mobile of the caregiver. So in that way, whenever the daughter goes to visit this elderly patient once a week, she can connect her mobile with the glucometer device, and then she can transfer all data to the hospital. And then we will make the contact with the caregiver rather than with the elderly patient that sometimes have very important difficulties either to answer the phone or even understand what we're trying to explain, referring to the insulin treatment. So I think in those cases, it's very useful, the new technologies, but you have to focus sometimes on the caregiver rather than in the patient.
Yeah, thank you for your answer. Also, caregiver, I think, is an important role that we should all consider when defining all our strategies and activities. Okay, so then I'll give the floor to the audience. Is there anyone from the audience who would like to pose a question for the panelists? We have a shy audience today. No? Okay, then I'll ask myself a question to Dr. Yun and Dr. Pedraza. We've seen how these new digital transformation processes are actually starting to get inside our current procedures. So which aspects must be considered to replicate good results that may be happening at the level of a project or at the level of a specific services? Which could be the key messages that the audience can take away home as to what are those aspects that we can consider to try to make a success and to replicate good results from one specialty to another or another area? Dr. Yun, you can start, please.
For the first time, I think the key element, or the first key element, is demonstrate that the effectiveness or clinical evidence of that a new solution, a new health or digital transformation is usefulness is crucial to demonstrate and to implement this in the care system. And second is to adapt all the resources, all the context to integrate the professionals, the patients, all the system, all the citizens to this system. I think first is demonstrate that is effective, the effectiveness in clinical evidence, and second, to adapt the system because the integration could be effective.
Thank you, Dr. Pedraza.
Yes. In addition to that, what I said before, I think that the key issue is teamwork. In my experience, to apply artificial intelligence in radiology is not only about radiology, it's about the hospital, because we need to develop a team with engineers, informatics, all the clinicians. So we need, it's an issue of the hospital. So if you build this teamwork in all the specialties, you can succeed. If not, will be a problem.
Okay, thank you. So with these two takeaways, we can finish this session. I think it's important. It's coming again and again. Technology is not the real problem. We are talking about culture. We are talking about organizational change. We need to define strategies which are tailored to the stakeholders, to the ecosystem of people, patients, caregivers, professionals who are actually involved in a healthcare procedure, to draw down which is the new, this ASIS, and to be processed, and to really think about to making use of the available tools that we've seen so far. So I would like to thank again the speakers, thank the audience, and I'll give the floor to Yolanda, who will explain a little bit more about the next roundtable, which is actually a very interesting topic related to what I've just said. Thank you very much.
Well, let's move on to the second and the last table, round table, digital transformation and new digital skills. This table is conducted by our director, Josuè, and please join me in the stage, Joana Barbany, General Director for Digital Society of the Government of Catalonia, and Montserrat Gea, General Director of Health Professionals from the Department of Health in the Government of Catalonia.
Thank you, Yolanda. Only a few words about this second roundtable. As we can see, one of the challenges that we have is the skills that the professionals need to use all these tools that we have talked, explained it, and designed it. And on the other hand, it is necessary that the citizens have, obviously, skills to use these tools. So how to promote these skills, how to evaluate, how to put this on the table is that Dr. Montserrat Gea and Ms. Joana Barbany is going to explain from their point of view the citizens and the professionals. I think that Joana is the first one. Yes. Joana, please.
Thank you to everyone. Good morning. I'm not a doctor, so I don't know anything about health and everything, but I'm a citizen, and I'm a patient, usually. So I'll try to explain to you what we are doing in the Generalitat. As Josuè said, I'm General Director for Digital Society, so I'm in charge of keeping citizens capable in digital skills, okay? So we've been working in a project with TIC Salut, who's called TIC Level 3. I will tell you later about that. In Catalonia, we work in with an official certificate. It's called TIC. It means Accreditation of Competencies in Information and Communication Technologies. And now we just work with citizens and public actors, okay? A little bit of chronology. We began with this project 15 years ago, more or less, on 2007, defining what does it mean, what we need to validate and to certificate. So we work with academia, with policymakers, with the industry for defining what we were looking for. So in 2009, we begin with the accreditation process. And we start with some exams, okay? We are talking with about 3 levels, and I will show you later which level are each one. And then we've been working on that, and we are now in the 3rd content review, now in 2021 and 2022. And in this 3rd review, we are working with TIC Salut in a new sectorial at TIC 3. This is the 3 level, okay? So we want to know which level of digital competencies has the PHP, I mean the professionals of the health professionals. And we are also working for align the TIC project with the DigiCom. As you know, DigiCom is the accreditation for the European Union, and we are just now mixing the both accreditations. So, some facts and figures. As I told you before, we've been working on that for 15 years. We talk about 3 levels, 8 competencies, as you will see later. It's multi-language, it's 100% online. And in these 15 years, you can see here some figures. We work with more than 370 centers from all the Catalonia, public and private. So people who want to be examined, they have to go to these centers, and they just teach them, and they do exam there. In these 15 years, we've examined more than 125,000 tests and more than 80,000 certificates. Okay, I talk you about 3 levels. The first level, it's a basic level. It just allows you to know and apply technology. It's just, you know, as an actor, so you can do anything. The second level is the intermediate level, where you can be effective, adaptive, and autonomous. I mean, you can begin to, you know, to work with technology. And the third level is you are able to innovate, to share, to provide support, to, you know, you are domaining the ICT, and you can just work with technology. So you are an agent. It's not like you are not only an actor, you are an agent. There are the 8 competencies that I told you before. So it begins with the culture, with digital technologies, the use that you do with digital technologies, how do you browsing, management, and writing information. So here you can see the match between the competencies and the certificates. Okay, so now we are now working, as I told you before, in mixing the ACTIC with the digital com from the Europe, and we work in 5 areas, and always the citizen is in the middle. Okay, the 5 areas about search, management, and analysis of information is the first level. The second one, it's about communication and collaboration. The third one is who is capable to create content on the internet and to share and to program. On the fourth area, we talk about security. It's as you know, is a high level from the other one. And then at least if we measure if people or citizens or professionals are autonomous and they can solve problems. So what are not we doing? We are now working with TIC Salut, as I told you before. So the first level is the basic certificate, the level 1 is intermediate certificate, but now we are working in this level 3 just for health professionals, okay? Josuè before, I almost made the spoiler, but he wanted to talk about that. So the aim of this project is to design the digital competencies map for health professionals and also the assessment on this accreditation model. We want to lay the foundations for the elaboration of the learning contents, and also we are trying on creating these training itineraries, because it's a live project. It's not just, you need to be aware and to be just, you know, working on that. And where are we now? So we are now, as you can see, this is the project. We are now on the milestone 2 and milestone 3. We are defining the competence map, and we want to make the first pilot on this December, and we'd like to kick off this project on the second semester of the next year. So many thanks. If you have some questions, I will be glad to answer later.
So thank you very much to TIC Salut Social for inviting us to share our experience in this interesting seminar, and congratulations to the previous presenters, because it's so inspiring, all the practical things that you are capable to do within your services and with your patients. This is the real goal of all transformation, so thank you very much. So I will explain a little about this TIC Salut project that is focused on improving ICT skills in healthcare professionals. So first of all, I would like to explain just a little bit the context of where this project was born. So this is the Professional Dialogue Forum. It was a forum that started in 2018, and more than 70 entities participate in this forum, organized by the health department.
It is very important to remark that it was like a plenary of consensus, and a product of this consensus of the forum was the identification of 17 strategies or like objectives that we should move on. And we also identify more than 100 strategic actions corresponding to every single of these objectives. So it is also important to remark that participation of the entities include not only departmental or interdepartmental speakers, but also trade unions, healthcare professionals colleges, unions of providers, employers, scientific organizations. So it was a very big and ambitious project that today we are still working on. So we did like 3 plenary sessions, 1 per year, and we have planned to do a next one next December 2021. And it's important to mention also that the professional dialogue forum was focused only in professionals of healthcare professionals, which are defined in Spanish law at university level. So if you see the pyramid, just physicians and nurses compose more than the 60% of the workforce in Catalonia. So among those 13 challenges, the aim of the challenge number 4 was improving the digital competencies of healthcare professionals. The conclusions of the challenge number 4 were the definition of digital competencies of health professionals as the set of knowledge, skills, and attitudes related to the proper use of technological and digital resources to improve individual and general health in a safe, creative, and innovative way. So 7 competence areas were drafted. First, collaborative and participatory work. Second, digital communication and reputation. Third, research, creativity, and innovation. Fourth, data management and analysis. 5th, change management. 6th, digital awareness. And 7, information management. This is all the political and philosophical part, but let's see how can operationalize the project. The real operationalization of project was born in 2020 with the aim to deploy and implement the conclusions of this professional dialogue forum regarding digital competencies of healthcare professionals. The most important goals are on the screen. So it was designed the digital competencies map for healthcare professionals, create competencies assessment and accreditation model, lay the foundations for the elaboration of the learning contents, and support in the creation of training itineraries for the assessment and accreditation of competence. As mentioned by Joana, ATIC is the accreditation of competence in ICT for general citizens in Catalonia. So our strategy in the project was to take advantage of the already implemented infrastructure and processes and to develop a specific accreditation of competencies in ICT specific for healthcare professionals, so-called IDIBELL Salut. So as mentioned, for the general citizens, the different levels are basic, intermediate, and advanced certificates. So our purpose is to create this Active 3 just like an advanced certificate specific for health professionals, but also with the requirement of having at minimum level 2 of the general Active. So the project is structured in those 9 work packages. You can also see on the screen timelines of every milestone. So in December, the evaluation model will be developed and will be tested with final users in a pilot test on January next year. And then it is expected that Active 3 Salut accreditation will be developed by the second semester of 2022. So if we focus in work package 3 and 4, to create this accreditation, we are following the methodology shown here. So first, we perform an analysis of the state of the art to collect similar initiatives worldwide, which could be used as reference. Then we map those initiatives against the proposed digital competencies from the Professional Dialogue Forum and the current digital competencies framework from ACTIC. We draw the main areas and competence, and later we design the indicators of each competence, and we are currently working on the definition of the evaluation and certification model. Next steps will be the evaluation of the model through a pilot study in order to refine the model. The Open University of Catalonia is helping us in this process. So all the process is also co-designed with healthcare professionals, so all steps are validated with a panel of ICT health experts, and we also count with the panel of challenge number 4 from the Forum of Professional Dialogue for specific tasks. Here you can also see the governance of the project. So we have like 2 committees that are more at political level, the strategic committee and the executive committee that is composed by members of my direction and also Josuè's, this Catalan Health Service of Health, and then TIC Salut Social. And then the coordination of the project is with TIC Salut Social and internal and external support. So to end my intervention, I would like to present a little an exploratory study that we did last June, July. So in the context of this ComTeach project, we carried out an exploratory study in order to analyze the current level of digital skills of healthcare professionals in Catalonia. The final goal of this study was to detect possible existing gaps in digital skills. Healthcare professionals, both from public and private health, were invited to participate through the healthcare professional colleges and healthcare professionals, employer associations, and public healthcare entities. An ad hoc questionnaire based on ACTIC intermediate level was designed and released online during June and July for professionals to answer. So about 800 professionals participated in this survey, and according to results, 2/3 of professionals did not achieve the intermediate level of ACTIC. Some specific weaknesses in ICT skills were found, like information organization, data analysis, shared work, content design, and digital civics. The sample admitted having training needs both in ICT general skills and the use of ICT health tools. So finally, the evidence found through diagnosis and analysis indicates that the instrument used is valid to know about the level of ICT skills of healthcare professionals. So these results will help us to, for sure, to draw specific actions in the training plan of healthcare professionals. So that's all, and I hope to show you the new phases of the project in next conferences. Thank you very much.
So, yeah. Okay, thank you very much for your presentations. The message that 1/3 of the health professionals have not enough skills to develop digital skills to develop his work is very bad news. So we have a lot of work to do in order to provide all the tools to improve those skills. I don't know if you have enough time for just one question. 5 minutes, okay. Are there any questions about, if not, I have a lot. No? No in the network either? No questions. Okay, so about not the professionals, about the citizens, what is the feeling about, in your experience, have the citizens enough skills to use all these elements, those tools that we're going to provide from the health system?
Well, there is a need also for citizens, and the pandemic has shown that there is a digital gap, and this gap is increasing. So we need to work on that as public servants. We need to work on having our citizens with more competencies, because if not, they won't be able to live in this world, no? And also, they won't be able to be a good patients, as I said before, because they will need to, to do teleconferences with their doctors. So we need to work in citizens and in PHP also. So there is a lot of things to do.
Okay, thank you. And in your experience, other countries, other European or American countries, has the same problem about digital skills, or? Yeah, it works.
Yes. Okay. So from my experience in other countries, they don't conduct a survey as ambitious as us. I think in United Kingdom, but not in the rest of Europe. We have some literature, scientific literature, focused on specific centers, but not as ambitious as all the health system. And I would like just to add a little bit of your comment in the first, because we have to think that these 2/3 of professionals that don't achieve the intermediate level of digital competency is after the pandemic. So it is supposed that they are used to work every day with patients at home and using remote devices or remote solutions. So I don't want to know what, previous to the pandemic, what was the situation, right? So.
Okay, I hope that next weeks we're going to present the final results of this survey, and I invite you to participate in this project, and in the future in the definition of the levels, and obviously in all the process. Thank you very much, Joana, Montse,
Thank you.
and thank you very much for your attention. Thank you.